All right, hello. This is Dr. Melvin Thornton. Welcome to the Worldwide Surrogacy webinar on everything surrogates need to know about the COVID-19 vaccine. It's a pleasure to speak with you today. A little bit about Worldwide Surrogacy is that it's an amazing surrogacy agency. Those of you who don't know that, it is like one of the best in the United States throughout the world. And you see all those happy faces there? They are truly happy people, and all they care about is helping build families. Worldwide Surrogacy is one of the first and foremost surrogacy agencies in the United States. It's actually located in Fairfield, Connecticut. For those of you who don't know Fairfield, Connecticut, it's a beautiful part of Connecticut. It's probably about an hour and 20-minute, hour 30-minute train ride from Fairfield to Grand Central Station here in New York City. And they proudly provide unparalleled personal support for surrogates and intended parents every step of the way. And that is so true. I love the ladies at Worldwide Surrogacy. They've helped bring so many babies into the world. And the most important thing is the safety of the surrogate. Screening, counseling, amazing. You won't find a better agency than Worldwide Surrogacy. Now, with that wonderful introduction about Worldwide Surrogacy, a little bit about me. I'm just a guy that kind of helps people have children. But no, I'm the medical director at Global Fertility Genetics, Dr. Melvin Thornton. I did all my training in Los Angeles, University of Southern California, made my way to New York, worked at Columbia University, where I was the egg donation program director for many years. Went into private practice just to kind of help more intended parents realize their goal of building the beautiful family. Today, I want to talk to you about something that's very special, which is the COVID-19 vaccine. A lot of myths out there. What I want to do is in a non-threatening manner, just kind of give you a take on what the vaccines are about and the recommendations for who should be vaccinated, who should get boosters. And these things are all developing as we go. And even today, right now, as we're doing the webinar, the FDA is meeting to decide if they're going to give approval for vaccination for those who are under, I believe it's 12 to 5 or 11 to 5. So this is exciting. My son, who turns 11 next week, can't wait because he wants to go out and enjoy the world like he did before. So he can't wait for the approval so he can get vaccinated. The agenda we're going to talk about today is just an overview for surrogates. You have lots of questions, so we're going to answer your questions, and then we'll go for a live Q&A. So this will give you a little overview for vaccines for the surrogates. What does the CDC recommend? Okay, the CDC recommends and strongly urges pregnant women to get vaccinated. Okay, the American College of OBGYN recommends women who are pregnant, soon to be pregnant, and lactating women to undergo COVID vaccine vaccination. The reason why this is recommended because when women who are healthy, like you all are, your surrogates, you're nice and healthy. However, when you get pregnant, your immune system does become compromised. Okay, this is the reason why your body allows an embryo to implant and develop, because your immune system gets somewhat suppressed. And so women who are pregnant are more susceptible to certain types of illnesses due to their immunocompromised state. Now, when COVID first came out, there were women who were pregnant and they were getting COVID, and we didn't know, what to do. A lot of women got really, really sick. Some of them ended up on ventilators. But now, more and more with the Delta variant that's out there, we're seeing more and more women who are pregnant are coming down with severe illness of COVID. And now we know that it is crossing over to the placenta and it is affecting the fetus that they're carrying. There's been some cases of stillborns related to COVID-19 infection. So this is very, very important for those of you who are going to become surrogates, considering taking someone who's very healthy like yourself and becoming immunocompromised. We want to make sure that you're safe and you have a safe and beautiful journey with your pregnancy. So once again, CDC American College of OBGYN, American Society of Reproductive Medicine strongly recommends that the COVID vaccine for women who are pregnant, before they get pregnant, get vaccinated with the COVID-19 vaccinations. Okay, and the reason for this is that the benefits will outweigh any known or potential risks, and that benefit is keeping you and the fetus healthy. So there are different types of COVID vaccines out there to hear about. The Pfizer these are we'll call it messenger RNAs, and then there's the Moderna, which is a messenger RNA as well. The most important thing about these vaccines is that if you get vaccinated, none of this gets incorporated into your genetic makeup. It doesn't cause any harm to you. The way it works is that you put a little bit of the messenger part of the virus into the vaccine, and then what happens, your body generates a response or antibody response to that little messenger or that little part of the COVID vaccine, the messenger RNA. And the idea is that you generate now these antibodies so that if COVID does enter your body, your antibody response will be robust, attack the virus, and you won't get sick. Okay. The most important thing about the vaccines is that it's been shown across the board to decrease severe illness, decrease hospitalizations, and decrease death, which is the most important thing. And then one thing to realize is that almost 750,000 Americans have lost their lives due to COVID, which is close to the number that we lost in all the wars combined. So this is a really serious pandemic, worldwide pandemic, and we each of us have to do our best to try and end the pandemic. Other things about the vaccine that's important to know is that in the US, there have been over 408 million dosages. Side effects are very few. Severe side effects are very rare. And worldwide, there's been almost over 28 billion doses of the vaccine being given. When you look at the efficacy and data, there's been tens of thousands of people studied who received the vaccine, and it's been shown to be safe. It's been shown to be effective, and all these vaccines have met the FDA standards for manufacturing quality. When you look at the side effects of all the vaccines, the rare or minimal side effects, most common side effects you'll see is that you may get like a little swelling, a little redness at the injection site. Sometimes people get a little fever after the injection, may have a little headache, a little muscle fatigue. Some more severe side effects are anaphylaxis. Some people get like a really bad reaction to it. So if you do get vaccinated, after your vaccination, it's recommended you kind of hang out for about 15, 30 minutes just to make sure you don't have a reaction. And every place that does vaccinations will have things such as the EpiPen in case you do have an allergic reaction to the vaccine. And just by taking an EpiPen injection, it resolves any side effects of the allergic reaction. So once again, these vaccines are very safe. They've been studied worldwide. Over 1 billion doses have been given, and in the US, over 408 million doses have been given, and it still shows to be safe and effective for the treatment of COVID-19. So let's talk about some of the common questions that we see and we hear. I'll go through these, and then after I go through these questions, we'll go through some live Q&A, right? Do you need to get vaccinated before you apply to become a surrogate? The answer to that question is no. You do not have to be vaccinated before applying. A lot of questions that do come up is, I'm thinking about being a surrogate. Should I get vaccinated now, or should I wait till I get matched? The answer is you always want to get vaccinated sooner than later. Okay, so if you're thinking about being a surrogate, you're thinking about getting vaccinated, I would say it's best to get vaccinated right now. For those of you who are, for other reasons, don't want to get vaccinated, you still can apply to be a surrogate. Next question is, if you've chosen not to get the vaccine because of religious beliefs, are you still able to be a surrogate? That is a very, very good question, and it's a very tough question. The reason I say it's a tough question is because when you look at the different fertility clinics that are out there, every fertility clinic is going to have their own policies and procedures. So there can be some clinics out there that will say, well, we're not going to work with surrogates that haven't been vaccinated. There'll be other fertility centers out there that say it's a patient's choice what they want to do. I'm of the belief that I'm not going to force anyone to do something they don't want to do. So in other words, if someone comes in, they want to be a surrogate, I'm not going to force them to get the vaccine. My job is to talk to you about the risks and benefits of being pregnant in this time of the pandemic, talk to you about the risks and benefits of the vaccine, and help you make a very educated choice, an educated decision, so that once you decide, hey, I don't want to get vaccinated, perfectly fine, or if you decide that you do want to get vaccinated, perfectly fine. So next question, can getting vaccinated be a potential conversation with intended parents? Can it be their decision if they are comfortable with their surrogate not being vaccinated? You know what, this is a ever evolving situation with the pandemic, the vaccines, and surrogacy. Once again, the most important thing is that is between you and the intended parent. A lot of intended parents want to have surrogates who are vaccinated because they're worried about the risk of COVID with their child in pregnancy. So they do have conversations with their potential surrogates about do they want to get vaccinated or not. I think it's always good if you've been matched with the intended parent that you discuss the availability of vaccines and your beliefs on vaccines. Once again, is that you can be vaccinated at any time. You can be vaccinated before the pregnancy. You can be vaccinated during the pregnancy, and you can be vaccinated after the pregnancy. So the time is not the key. You can be vaccinated any time, but it's always good to have the conversation with the intended parent to see, okay, where do they stand, where do you stand, and come to a happy medium, or are we going to continue to stay in the match? Or because I'm looking for a surrogate and I want her to be vaccinated, I'm going to look for someone else. The most important thing, being a surrogate, is your individual right to make that decision. However, as a medical profession, all the surrogacy agencies, our goal is to make sure you're educated on the vaccines, take any myths away, and make sure you understand the risk of becoming pregnant in the era of COVID-19, and make an educated decision if you get vaccinated or not. Next question, am I putting myself with a baby I'm carrying at risk by getting vaccinated? The answer is no. The vaccines have been studied in pregnant women. Thousands of pregnant women have taken the vaccine, and it's been shown no adverse effect on the woman who's pregnant or the baby. Okay, you can be vaccinated at any time during the pregnancy. Once you find out you're pregnant, you can get vaccinated the first trimester, second trimester, third trimester. It is safe to get vaccinated at any time. Okay, so the answer to this question is no. It is, you are not putting the baby at risk or yourself at risk by getting vaccinated in the pregnancy. Okay. However, if you don't get vaccinated, now you're putting yourself and the baby at higher risk for developing COVID and the complications of severe COVID, such as being hospitalized, being placed on a ventilator, and even in cases now, we're still seeing deaths occurring in this country, about 3,000 deaths per day. Can I answer this question a little bit? And the last one, is it safer to get vaccinated during a specific trimester, or is it safer to get vaccinated before becoming pregnant? The answer to this question, the best time to get pregnant is any time. Before you get pregnant, while you're pregnant, after you deliver, while you're lactating, the best time is any time. So if you're thinking about being a surrogate, and remember what we talked about being immunocompromised during the pregnancy, then it's safer for you to get vaccinated prior to getting pregnant. However, if you didn't get vaccinated prior to the pregnancy and you're worried about COVID-19 once you're pregnant, it's safe to get vaccinated at any time, any trimester is safe to get vaccinated. Will I be more likely to suffer side effects of the vaccine if I'm pregnant? The answer to this question is no. There's no increased side effects to the COVID vaccines if you're pregnant. the typical side effects that you get will be the same side effects that the average person who's not pregnant gets when they take the vaccine, which are very rarely you're going to get some redness at the injection site, maybe a little pain at the injection site. Quickly goes away within 24 hours if you do have any of those side effects. Some people get a little fever, lasts for 24 hours. Some people get headaches. But those are the usual side effects that we see from the injections. So you will not suffer any side effects from the vaccine if you take it, if you're pregnant or you're not pregnant. Once again, can't help stress this out enough. If you don't have the vaccine and you are pregnant, you become immunocompromised, and your risk for developing a COVID-19 infection is increased, and thus putting yourself at risk for hospitalization, possible being placed on a ventilator, and then, hate to talk about death in someone young and healthy like a surrogate, but there is that potential for death if you develop severe COVID-19 while you're pregnant. Does the vaccine have any effect on the medications I'm taking in preparation for my embryo transfer? The answer is no. It does not have any effect on the medications that you're taking. My recommendation for those of you who are thinking about getting the vaccine is to do it before you start the cycle, if possible. If you're going to get it while you're on medications, it's probably best to delay the transfer for a couple weeks. The reason why I say that is because when you take the vaccine, your immune system gets revved up because it's protecting you. And many times you want the immune system to kind of come back down to its normal state before you transfer an embryo. So I usually tell patients that if you're going to get vaccinated, you want to wait for a couple weeks before you do a transfer. So if you're starting your medications now and the transfer is scheduled for 3 or 4 weeks from now, that's perfect timing. You get vaccinated, and that way you're having to transfer about 2 weeks after your dose of the vaccine. So now I'm going to go over to the live question and answers. I hope that was informative. The most important thing, like I say, is that we want you guys to be safe. We want you to have a wonderful, exciting journey. We want you to have a safe journey. When I look at records to review if someone's a good candidate to be a surrogate, the most important thing to me is it's safe for her to go through another pregnancy, if it's safe for her to go through another journey. So that's our most important number one thing that we want to do. So taking vaccines for COVID-19 is another layer to help protect yourself to get through a safe journey during the pregnancy.
Hi, Dr. Thornton. I'm going to be reading off some of the questions that the attendees are asking. And
Okay.
if you could please answer, that'd be fantastic.
Okay, we're still live right now, right?
Correct.
My biggest fear when I do the Zooms like this is that I go through this whole thing and no one heard anything I said. So I hope that everyone my audio was good.
Yes, absolutely. So our first question does come in from one of the attendees. Would you recommend getting the booster shot if you recently became pregnant?
The answer to that question is that the booster shot is particularly recommended in those who are immunocompromised or immunosuppressed. So if you recently became pregnant, that means that you're immunocompromised because of the pregnancy. So definitely recommend getting the booster shot.
All right. And yet another question from the attendees. What about natural immunity?
Natural immunity. So I think the question that they're asking is, what if I've had COVID already and I have antibodies to COVID? It's still recommended that you get the vaccine because it offers more protection than the natural immunity does, more lasting protection. And it's been shown that even if you have natural immunity, we don't know how long that natural immunity will last. So we still recommend that people that have had the COVID-19 infection in the past with documented antibodies still get vaccinated and still take boosters when indicated.
All right, excellent. Are there any more questions from our attendees today? We have another one.
I love it. That's fantastic.
And the question is, are there any other vaccines required before becoming a surrogate?
Are there any other vaccines? First of all, there are no vaccines that are required. First of all, that's want to make sure you understand that. The other things that we look at when we're screening surrogates is that we'll screen you to make sure you've been immunized to rubella. Rubella is German measles. If you haven't been immunized, we will recommend that you get vaccinated for rubella so you don't develop measles in the pregnancy. However, that being said, it's still your right not to accept the vaccine if you don't want to be vaccinated. But other than that, there's no other vaccines that we recommend. Let's just say now that you're pregnant, because you will get pregnant because you're a wonderful surrogate, okay? We still recommend taking the flu shot because once again, you're immunocompromised and you have a higher risk of developing flu and severe complications from the flu. So every pregnant woman is recommended to get the flu shot. The next question that I have for you is, can I get the flu shot and can I get the COVID vaccine at the same time? The answer is yes, you get both of them together. If you want to wait a little bit, then you can wait for 14 days and get the second one. But it's definitely recommended to get both the COVID vaccine as well as the flu vaccine while you're pregnant. You can do both of them at the same time.
All right, great. Another question that we have here. If you decide to get the vaccine while you're pregnant, should you wait until after the first trimester?
Oh, very good question. When should you get it once you're pregnant? The data shows that it's safe to get the vaccine at any time during the pregnancy. The reason why is because you can get COVID at any time, so it's better to get the vaccine sooner than later. So in the first trimester, second trimester, third trimester is safe to get the vaccine. It does not affect any outcomes of pregnancy. It does not cause a miscarriage or anything like that from taking the vaccine.
All right. And another question here is, how soon should I get the vaccine before the actual transfer?
I would recommend getting at least 2 weeks before the transfer. You want to give yourself a little 2-week cushion after you take the vaccine before the transfer. So most of the programs will start you off on some estrogen. Most programs start you off on birth control pills. While you're on the birth control pills, feel free to get vaccinated. Or once you start the estrogen, feel free to get vaccinated because your transfer is probably going to occur maybe about 3 weeks after that you start the estrogen.
All right, just seeing if there are any additional questions that do come in. And yeah, so Dr. Thornton, I have to say thank you so much for taking the time out of your very busy schedule today to sit down, walk us through the COVID-19 vaccination and its safety with surrogates. If there are any additional points that you would like to leave off with, I know that everyone would be more than happy to hear.
Yeah, thank you. It was a pleasure. And like I say, the one thing that's really, really important when every potential surrogate, who also is a surrogate right now, our number one goal is your safety, okay? And you're doing a wonderful thing for these intended parents, and we want to keep you safe before you start the journey, during the journey, and after the journey. So, please consider the COVID vaccine if you haven't been vaccinated. Protect yourself because, pregnancy is a tough time, and when you're immunocompromised in the times of a pandemic, it's important that you protect yourself. And these vaccines have been shown to be safe in women who are pregnant, safe for you, safe for the baby. So if you're kind of on the fence about getting vaccinated, I would say lean over towards that side of getting vaccinated to protect you as well as protect your family.
Excellent. And we did have something else that came in. It's not
I
really
love
a question, but a comment. We just wanted to say.
A comment. Oh my goodness.
Yeah,
Let's see. Da-da-da-da, the comment.
They just wanted to say, thank you, Dr. T. You are the best. And you really, thank you so much for your time today.
It's my pleasure. I really enjoyed it. Thank you.
Thank you. And if anyone has any other questions, please feel free to reach out to a Worldwide Surrogacy Specialist. They're always there, willing to answer any of your questions, and look forward to having additional conversations with you.
Take care.
Everyone take care.